Let's talk about, again, weird causes of low thyroid. What actually contributes to low thyroid? We're going to get into the vitamins and the minerals in a minute. I just gave you kind of a mini crash course on that. But some of the things that cause low thyroid are the things you put in your mouth. Now, those of you watching this show, I like a little participation. How many of you, when visiting your doctor, if you have low thyroid, how many of you had a doctor that actually sat down and talked with you about diet change as a dominant way to get your thyroid back under control? Raise your hand. Just put a comment below in the chat box for me. I'll go back and read those later. But diet is very rarely discussed amongst doctors, especially amongst endocrinologists. As a matter of fact, if I had a quarter for every time I heard an endocrinologist tell a patient that diet has nothing to do with low thyroid. And this is low thyroid, whether it's just classic hypothyroidism or whether we're talking about Hashimoto's thyroiditis. But these are three big factors that we're certain can create increases in inflammation that can disrupt your thyroid function: gluten, dairy, and sugar. And so changing how you eat can, in many cases, and I've seen this happen in many cases, where the actual thyroid condition starts to go away altogether. So this is how powerful diet is. Now I'm going to show you some research studies on diet. So we look at several of these are on gluten sensitivity, and you can see your effect of a gluten-free diet on autoimmune thyroiditis progression in patients with no symptoms or histology of celiac disease. In other words, these are people that aren't diagnosed with celiac disease, but they're still going on a gluten-free diet because they have autoimmune thyroiditis. And so in the result column, you can see here, our results seem to indicate a positive effect of the gluten deprivation, meaning a gluten-free diet, on thyroid function and its inflammation, particularly in patients with Hashimoto's thyroiditis and gluten-related conditions. So again, in this study, they found that a gluten-free diet was actually helpful at reducing the antibody inflammation in patients with Hashimoto's. Now, in this research study, also related to gluten, you can see the presence of anti-gliadin antibodies in autoimmune thyroid disease. Gliadin refers to gluten. So when you hear that word gliadin in the future, you know that gliadin is a type of gluten. It's the main type of gluten. Might help if I spelled this right for you. It's the main type of gluten found in wheat. So it's an anti-gliadin antibody in autoimmune thyroid disease. You can see they did 22 patients in this particular study with autoimmune thyroid had positive anti-gliadin antibodies. So 5% of the patients that they studied, 5.5%, had actual positive anti-gliadin antibodies. Conclusion: polyglandular endocrine syndrome is the commonest cause of positivity of anti-gliadin antibodies in the patients with autoimmune thyroid disease. Now, I would argue this is a good study because it makes the connection, but I would argue that this study actually wasn't finding quite as many people with gluten problems as maybe it could have, and let me explain why. When you're looking for these antibodies, these gluten antibodies, generally what doctors are measuring is they're measuring IgA is a type of antibody. And so they're generally what they're measuring is antibodies to IgA. Well, one of the side effects of gluten exposure over long periods is IgA antibody deficiency. So what happens is you get these patients that they're testing their antibodies to gluten, to gliadin, and they're finding that, in this case at least, 5% had high levels of antibodies. But how many of these patients actually had an IgA deficiency? And so when they went to look for antibodies, they couldn't find them because the patient actually wasn't making antibodies. And so you get a false negative on an antibody test. It's a very, very common thing that's seen. And it's a very common problem that's been linked to people with gluten sensitivity, is something called IgA deficiency. So again, there's a study here that correlates gluten antibodies in patients with thyroid disease. And then we have another one here, so that one shows the connection. This one actually shows the outcome, right? So the effect of a gluten-free diet on autoimmune thyroiditis Down here you see our results seem to indicate a positive effect of the gluten deprivation on thyroid function and its inflammation, particularly in patients with Hashimoto's thyroiditis and gluten-related conditions. Again, then we have this study here. You can see gluten elevates thyroid inflammatory antibodies for up to 6 months. So again, eating gluten caused elevation in thyroid antibodies this long a period of time. Now, if you've ever watched my course, I've done a course on how long does it take to get gluten out of your system. Generally, the answer is 3 months, but in this case, gluten exposure causing antibody elevations for up to 6 months. And again, why is that important to understand? Because these antibodies are inflammatory and they do inflammatory damage to the thyroid gland. Then we have the effect of the gluten-free diet on thyroid autoimmunity in drug-naive women. And you can see here the gluten-free diet reduced thyroid antibody titers as well as increased 25-hydroxy vitamin D levels. So in this study, we got lower antibodies and we got improvement in vitamin D. That's what 25-OHD is. So going gluten-free actually improve vitamin D and reduce the antibodies. And you know, some speculate as to why would a gluten-free diet improve a person's vitamin D status. You know, we're not talking about a situation where we're supplementing people with vitamin D. We're just talking about vitamin D levels improving as a result of a gluten-free diet. And one of the biggest reasons is inflammation. So what happens in a gluten-free diet, if a person's gluten sensitive particularly, what happens is going gluten-free reduces inflammation. And when you reduce inflammation, you don't need as much vitamin D because vitamin D is an anti-inflammatory. It actually is well, technically it's not anti-inflammatory, but it regulates inflammation. It helps the body regulate and control inflammation. So when inflammation is lower, your body doesn't have to use as much vitamin D. And so there's a sparing effect, if you will, on vitamin D. And so one of the reasons potentially why vitamin D is going up with a gluten-free diet. So again, going gluten-free, lots of benefit associated with, especially with Hashimoto's disease. Now, there are other foods that can contribute to goiter, and I don't want to sound like an alarmist, so as you look at this list on the board here, don't think that you can never have any of these foods ever again for the rest of your life if you are dealing with a thyroid problem. What I'm pointing out here is that these foods are also sometimes referred to as goitrogens. In other words, they can contribute to dysfunction in the thyroid. So it's not so much that you could never eat peaches or strawberries again. However, if these are your primary staple foods and you're throwing all these things into a big smoothie every morning and drinking it green in large quantities, which a lot of people do, they put flax and spinach and broccoli and kale and they blend it in a blender, and sometimes they'll add in strawberries and then they'll pour in their soy milk, and that's breakfast every day. That's a thyroid bomb. You're taking too many of these goitrogens and you're putting them all together, and then you're creating, a primary source of calories from these foods alone. So again, it's not that you can't eat these foods if you have a thyroid problem. It's that you want to be aware that if you overconsume these foods consistently, you may be creating or contributing to goiter formation in your thyroid. And so again, a goiter, we got this image here. If you look at this image, you can see this outline of this enlargement in the neck. That's kind of what a goiter is, a cartoon figure, but that's what happens is you get an enlargement in the neck because the thyroid starts to grow. Now, there's some other things in the diet that can impact the thyroid that we'll share with you as well. And one of them is sugar substitutes. This was a study published a few years ago. Excessive use has been linked, so we're talking here, excessive use has been linked to hyperphagia and obesity-related disorders. And in this case, we're talking about artificial sweeteners, or what are known as non-nutritive sweeteners. You can see animal studies report that artificial sweeteners affect the immune system. Moreover, animal studies show that sucralose diminishes the thyroid axis activity. We are presenting the case of a 52-year-old female with autoimmune thyroiditis with hypothyroidism, or Hashimoto's, induced by an excessive intake of beverages containing non-nutritive sweeteners. So if you're sitting there holding the 72-ounce stop-and-go mug full of Diet Coke, I'm talking to you. It's the excessive quantity of these non-nutritive sweeteners that can impact your ability to make thyroid hormone. In this case, the quick return of thyroid-stimulating hormone and antibody levels to normal after eliminating the use of sugar substitutes. So again, this is a medical case report of a woman who was over-consuming these beverages, and when she stopped doing it, it normalized her antibodies and improved her thyroid hormone function output. Now, there's a reason why this happens, in particular with a type of sweetener called sucralose, which is what this study was based on. Sucralose, aka Splenda, is I think the brand name of this product. What is it exactly? What is Splenda? It's chlorinated sugar, right? So what they did to make this stuff is they just added chlorine to sugar. And one of the problems with chlorine, when we look at what chlorine actually is something called a halide. Now, there are a number of different halides. Let's move this out of the way and make some room. Halides, if you look at a periodic table of elements, include iodine, chlorine, fluorine or fluoride, and bromine. So these are again, all fall on the same section of the periodic table of elements. This group is referred to as halides. And what do we know about halides? We know that these three here compete for uptake into your thyroid with iodine. So remember, iodine has specialized little devices or little importers on the surface of thyroid cells where there's special channels designed for the uptake of iodine. And so what happens is these other three are so similar to iodine, they will compete for uptake into the thyroid gland through those transporters. And so if you're consuming large quantities of sucralose, which again, it's chlorinated sugar, it's got chlorine attached to it, you're increasing the competition between iodine uptake and chlorine. And if chlorine wins this war, right, then you can impact how much iodine is available for your thyroid to use. Remember what we said earlier, T4, which is thyroid hormone, that 4 represents 4 molecules of iodine. So again, if you've got excessive chlorine coming into the diet, you're going to inhibit that iodine uptake. So in this case, it's sucralose, but there are other examples where we get too much chlorine as well. Swimming pools, if you're in a swimming pool every day, especially indoor pools where the chlorine vapors sit on top of the water, that you can breathe them in much more easily, plus you're bathing in chlorine as well, and it can absorb through the skin. But we also get chlorine in our drinking water. If you live in a city and you're drinking tap water, you're getting chlorine every day, and that can have a huge impact on how your thyroid hormone is going to be produced and functioned. And then we've also got, again, fluoride and bromine. And so what do we think about here? We think about things like the toothpaste that you're using. You know, a lot of the dentists tell you how awesome fluoride is for you, for your teeth, and really it's not necessary. You don't need a fluoridated toothpaste. You don't need a fluoridated mouthwash. I would argue that those things are doing more harm than good. We also have fluoridation to the water as well. So if you think about tap water is like one of the worst things that you could drink for your thyroid. If you want healthy thyroid gland function, don't drink tap water. Drink a spring water, definitely, or filter your water. There are great filters that'll pull fluorine and chloride and bromine out of your water, because bromine is another one that sometimes gets added to the tap water. It gets added to the municipal water supply, because why? These things kill life. This is why they get added. They're antibiotic. In a sense, they're antiseptic to the water supply, so the city will clean or make sure that you're not drinking, festering bacteria in your water, which is a good thing. However, when that water makes it to your house, you don't want to take in these antibiotics, these natural antibiotics, into your body. So now the next step would be, it comes to your house, you filter that stuff out as you drink it, and that way you don't have to worry about it, and you can still drink clean water that's not contaminated with bacteria, but also not contaminated with halides that will compete with iodine for uptake into your thyroid and destroy how your thyroid functions. So, quick crash course on that. Now, we also have another common beverage that most people drink every morning, and that's coffee. And I'm not trying to take away your coffee, but I just want to point some things out around coffee and thyroid. Specifically, this is for those of you who are gluten sensitive and for those of you who are taking thyroid medication, okay? So you can see here, coffee intake led to a decrease, okay, and I'm going to fast forward because we don't really need this information because we're not talking about type 1 diabetics and rheumatoid arthritis, at least not today. Coffee intake led to a decrease in levothyroxine absorption in Hashimoto's disease. What does that mean? What is levothyroxine? Levothyroxine is thyroid medicine. It's one of the most commonly prescribed medicines in the United States. I think it's in the top 5 of all drugs, but it's the most common thyroid medication prescribed to folks that have low thyroid. And so if you are taking levothyroxine and you're drinking coffee to take it, you could reduce its absorption and you could reduce its functionality or its ability to help you, right? So just be aware of that. You know, this is one of the reasons why on these medications, it'll say take a couple of hours away from eating, but also in this case, away from drinking your coffee. Now, the other thing that it's important to understand, I said those of you who are taking medicine, but I also said those of you with gluten sensitivity, is that coffee consumption is associated with cross-reactivity with gliadin antibodies in celiac patients. So, what does cross-reactivity mean? We look at gluten, and let's just draw kind of a generic. Let's say that gluten looks like this, okay? What does cross-reactivity mean? Well, let's say that coffee, elements in coffee, also look like this, right? They look very, very similar. They have what we call in biology homology. They look very much the same. So if you are reacting to gluten and you're drinking coffee, and this isn't for everyone, but this is for many. I see a lot of people with gluten sensitivity also react to coffee. But if you're reactive to gluten and you're drinking coffee, then that coffee can look similar to gluten, and so your immune system might take it on, right? So this creates an immune response as if the coffee was gluten. And what did we just show you? We just spent the better half of a few minutes anyway talking about the association of, you know, gluten and the gluten-free diet on autoimmune thyroiditis, right? So we've got all these studies that have been shown where gluten increases autoimmune thyroid disease. So if coffee can mimic gluten, basically, wouldn't it go to say that you should be careful potentially about it if you're struggling with persistent chronic hypothyroid autoimmune disease and you're not getting better and the medicine's not helping and you're drinking coffee maybe 1 or 2 cups a day or more, you know, you might want to reconsider that. Again, I'm not trying to take away everyone's coffee, but there's definitely a connection here, and I've seen it in a number of folks.